Hi everyone, and welcome back again to my YouTube channel. I hope you all are well today, and I hope you all are taking good care of your health. Thank you for stopping by. Thank you for watching my video, and also thank you for subscribing. God bless you. If you are new, special welcome and thanks to you. I am Regina Madu, a pharmacist. In this channel, I'll be discussing about health and wellness, by discussing diseases, treatment and preventions, foods and nutrition, and overall health related topics. So if you are interested in this kind of topics, please hit that subscribe button and also the bell icon for weekly update. Thank you. In today's video, I'll be discussing about the effect or danger of abusing or overusing antibiotics. The reason I'll be making this video is to bring to your knowledge what it means to overuse or abuse antibiotics and the danger or effect that's involved. First of all, what is antibiotics? Antibiotics are the drugs that helps to kill bacteria. So some of the examples of antibiotics are streptomycin, amikacin, amoxicillin, penicillin, doxycycline, which is under tetracycline, fluoroquinolone like ciprofloxacin, ofloxacin, sulfonamides, isoniazid, para-aminobenzoic acid, PABA, which is used for tuberculosis, and many other examples of antibiotics. And there are different classes of antibiotics. Each and every class of antibiotics have a spectrum of bacteria that are susceptible to it. That is the type of bacteria or set of bacteria that it can easily kill. There is no one antibiotic that can kill all types of bacteria. Earlier, before now, when there was no antibiotics, many people died as a result of bacterial infections. Until 1932, when Alexander Fleming found the first antibiotics, which is penicillin. And ever since then, there's been a lot other classes of antibacterials or antibiotics that have been discovered by researchers and scientists. But recently, more and more antibiotics are not being discovered like before. So what is overuse of antibiotics? Overuse of antibiotics or abuse of antibiotics is when someone takes antibiotics unnecessarily or taking it too often. And this overuse can be as a result of improper treatment, or let's say improper diagnosis, that is treating the wrong thing. And that is likely due to some diseases that are caused by virus, which may look like bacterial infection. Diseases like throat infection, it's not all throat infection that are caused by bacteria. Some are caused by virus as well, common cold or flu. Then skin infection or rashes, sinus infection or sinus inflammation, bronchitis, that is inflammation of bronchi. All these are diseases that are not caused only by bacteria, but whenever someone suffers from such, they can easily go and buy antibiotics. That cause overuse or misuse of antibiotics. Another thing is self-medication, where individual will just have one or two symptoms and feel like what they're suffering from is infection caused by bacteria, and they will go and buy antibiotics and take. This overuse can be also as a result of recurrence of infection, which can be as a result of compromised immune system. But mainly, let me say, out of this misuse, overuse of antibiotics, 60% of it is inappropriate, is when antibiotic is prescribed or taken when it shouldn't be taken or prescribed. And this abuse can be maybe every 3 months you are taking antibiotics if your immune system is compromised as a result of HIV or other immune disease. So the effect of this overuse is what I'll be discussing now. Because of this overuse or inappropriate use of antibiotics, antibiotics resistance, that is when bacteria has become resistant to antibiotics, when a drug that is usually effective to a particular bacterial infection, all of a sudden this bacteria will not be killed by that particular antibiotic that initially kills it. This resistance occurs when bacteria change its nature. It can be as a result of mutation. In this way, they can make the antibiotics ineffective or protect themselves against this antibiotics, so that the drug will become useless. And that is number one effect or danger of overusing antibiotics. The example will be like we all, when we get thirsty, we drink water and we get satisfied, right? And your thirst will quench. Okay, just imagine that all of a sudden, even though you are thirsty, you drink and drink water, but continuously you are being thirsty. It's frustrating, right? So that is just a similar thing. This bacteria become resistant to the drug. That you take the drug, but it will be like you're not taking drug. It will not cure the diseases. Ever since the discovery of antibiotics is a huge breakthrough in healthcare system, and many fatal infection like tuberculosis, gonorrhea, syphilis, and other bacterial infection that were very fatal as of that time become curable because of discovering of antibiotics. But now that the healthcare is faced with this antibiotic resistance by bacteria, is like a huge burden to the healthcare system, because every now and then, like day by day, many of the diseases that are easily cured by antibiotics are not being cured anymore because of antibiotics resistance. And it will be like taking us back to when there was no antibiotics to cure these diseases. This resistance, it will result one to be hospitalized, because if you are suffering from an infection that is not treatable by antibiotic easily, then you have to be hospitalized. One, because the dose of the drug will have to be increased, and for you to take such high dose, you have to be under the monitoring of healthcare provider. And also it increased the cost of treatment, because if you're suffering from infection that is caused by bacteria that has developed resistance to a certain drug, you have to take it for a prolonged period of time, okay? Because normally antibiotic is taken from 7 days to 1 week or so. So if resistance occurs, that means you may take it for 1 month in order to kill those bacteria, increasing the cost of treatment, because you have to buy more tablets. That's another effect of this bacterial resistance. And also increased side effects, because when antibiotics is developed, we don't just target on the bacteria, we also consider the human or the host that is taking the tablet. Is it safe for the host? And based on how safe this antibiotic is, the dose is determined. So if a very high dose of antibiotics is administered, side effect will also increase. So if the dose is increased, the side effect increase. And most of the safest antibiotics that usually treat many diseases are now being resisted by bacteria, making more potent, more powerful antibiotics to be easily prescribed, and that endangers one's health as well. Number 2 effect of this overuse of antibiotics is it eradicates, or it is harmful to the intestinal flora. That is the good bacteria that are found in the intestine or your gut. And each time you take antibiotics, it doesn't just selectively kill the bad ones and leave the good ones. It affects every bacteria that are found in the body. So, and this intestinal flora helps in digestion, it helps in the immunity, and it helps to keep the intestinal environment healthy. But if antibiotics is overused, it can make these good bacteria that are there to protect you to go bad. They can become aggressive. It's just like when someone is calm and you are continuously irritating them, they will retaliate. So it's just like that. So these good bacteria can go bad if they are constantly exposed to antibiotics. It can eradicate this intestinal flora, giving the bad ones chance to dominate. Okay, and when they dominate, the individual will have problems in the intestine, which will affect overall health. Another thing is that it can also cause these good bacteria to be resistant to these antibiotics. So if these good ones develop resistance to antibiotics, they can easily pass the gene. They can easily pass this resistant ability or characteristics to the bad ones. So even though there was no bad ones when you were taking the antibiotics and these good ones develop resistance, if eventually the bad ones came in, they can pass this gene to it. And if the bad ones develop resistance, they can multiply, right? Because bacteria multiplies rapidly. So if they multiply, the new bacteria form will also have the resistance gene. It goes back to the antibiotic resistant. So after looking at all these effects I just mentioned, you see that we are in trouble. Study shows that if the way in which healthcare provider prescribe antibiotics and the way we individual use antibiotic continues and nothing is done about it, by 2050, 60% of death will be as a result of bacterial infection. Because right now, even tuberculosis that used to be effectively treated by antibiotics are becoming resistant to the drug. And you know how fatal tuberculosis can be. And even multiple drug resistance is there. Many of the drugs like isoniazid that are used effectively to treat tuberculosis are becoming ineffective because of antibiotic resistance. Is it gonorrhea and many other fatal bacterial infection that were effectively treated with antibiotics that are becoming resistant, making diseases that were easily treated to be hard to treat? How do you prevent this overuse of antibiotics? The different way one can prevent this overuse of antibiotics is to consult healthcare provider when you feel like you have infection, or even do blood tests or tests that can help to confirm which type of bacterial infection you have, so that appropriate drug will be selected and treatment will be carried out. In that case, one doesn't have to expose themselves to antibiotics for a long period of time. And that thing is, don't self-medicate or take advice from anybody who is not a healthcare provider, because some people will be like, if they have rash or anything that they feel like is infection, they may call their friend and say, oh, I am suffering from this, I don't know what's wrong, or maybe just by talking, then the individual may say, oh, I had similar experience, take this drug, take that drug. It may be different from what you suffered from. So the best thing is to consult a healthcare provider. You don't necessarily have to go to the hospital to consult a doctor. You can go to the pharmacist and ask them. If you have a friend who is in healthcare line, you can ask them. But don't just walk into the pharmacy and just get antibiotics and start taking without even asking the pharmacist that sold the drug to you, or tell them what you want to use it for or what you're suffering from. And also, this does not just it's not just for the individual, but also for healthcare providers, because they too easily prescribe antibiotics. It's better to confirm. If the symptoms is not enough evidence to know if the infection, if it's a bacterial infection or virus infection or fungal infection, it is better to carry out tests that can rule out what kind of infection the person is having, and also the bacteria, before starting treatment. Another preventive measure is not to take antibiotics unnecessarily, just related to what I just explained. And that thing is to complete the course of treatment. If you are diagnosed with any kind of bacterial infection and you're given medication for 1 week or for 2 weeks, make sure you complete the course of treatment. I always say this in my videos. Even if you feel better, make sure you complete the treatment. If you have not been taking it serious after watching this video, please do take it serious, because if the course of treatment is not completed and the bacteria is not eradicated properly, they can easily come back again, and that will make you to start the antibiotics over and over and over again, and that can even make the bacteria to develop resistance to the drug you are taking, introducing you to higher or more potent antibiotics that have even more side effects. So if you are giving drug, complete your course of treatment, and don't even skip the drug. If you ask to take it 2 times in a day, just take it serious and take it 2 times in a day. Another preventive measure is to practice good hygiene. Keep your environment clean by washing hands regularly. Keep your environment clean, because if that is not done, one can easily be infected every now and then, making individual to take antibiotics frequently, adding to the reason why one can develop antibiotic resistance. And I hope by doing this you'll be more responsible individual, not just for yourself, because when you have antibiotic resistant infection, you can easily transfer it to someone else and it will spread. And also, for the sake of our offspring, take antibiotics responsibly. And for healthcare provider, prescribe antibiotics responsibly. Don't just prescribe antibiotics blindly. I hope you enjoyed this video and I hope you found it useful.